Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CFA York Operations Coordinator. I would like to officially open the 7th session of the Nurses' Voices Speaker Series. Today's session focuses on nurses' voices into the future. The series is being presented in partnership with the Nightingale Initiative for Global Health. I would like to begin today's session with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Tkaronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderators, our speakers, and our participants from around the world. Welcome to our webinar. I would also like to acknowledge our other partners and sponsors for this series, the Integrative Nurse Coach Academy, or INCA, and the Global Academy of Holistic Nursing. I would like, it is now my great pleasure to introduce Dr. Diva Marie Beck, co-director of the Nightingale Initiative for Global Health, for some more welcoming remarks. In the interest of time, Dr. Beck's and all of our panelists' full bios will be shared in the chat. Thank you very much for being here today, Dr. Beck, and for all of your work in helping put this session together. The floor is yours.
Thank you. Thank you so much, Francesco. Can you see me? Can you hear me? Good.
Yep, sounds good.
Good. Welcome to everyone who's reaching us from across the world. It's so good for you to be joining us in this innovative Nurses' Voices speaker series and this morning's Nurses' Voices into the future. We have a wonderful panel of people to join us, starting with our distinguished speaker from the United Kingdom, who has graciously given us a bit of time before her evening commitments. I'm very honored to be introducing her. Dame Anne-Marie Rafferty is representative of the World Health Organization Euro region. She was awarded this title as Dame, equivalent to the knighthood awarded to men, by Queen Elizabeth during the 2020 WHO International Year of the Nurse and Midwife, and presented to acknowledge her distinguished service and achievements. Dame Anne-Marie is a professor of nursing policy and former dean of the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care at King's College London, and she also serves as the founding director, president of the European Nursing Research Foundation. It is my honor, my privilege, to be introducing Dame Anne-Marie Rafferty. Anne-Marie.
Well, thank you so much, Dr. Diva, and it's a real thrill and a privilege to be here to say a few words to you this evening, and 1,000 thanks for the very kind invitation to do so. So I've got a bit of a little chesty cough, so I hope I don't splutter throughout this presentation. But I thought that given the theme of our webinar tonight was Nurses' Voices into the Future, and I know I'm only speaking for a short period of time, that I might start with a story. My opening gambit and premise, if you like, this evening is that there is mileage in optimizing what we've got, given the pressures in all health systems. And a few years back, before the pandemic, I think we have a new kind of title to describe time, which is BP. Before everything that before the pandemic, we have BC, we have AD, now we have BP. I attended the WHO Collaborating Centre conference in Glasgow, and I was the final keynote speaker there in a long slate of sessions. And I could sense as I entered the room that people were a wee bit weary. They'd actually also been dancing at a Ceilidh, which is a Scottish dance, and a particularly energetic one too, the night before. So perhaps that also contributed to the sense of fatigue. But thinking that death by PowerPoint was probably not what they wanted at that moment, I abandoned the slides and tried to make it more interactive. And given there was such a broad range of organizations represented in the audience, WHO, collaborating centres, ICN, Sigma, the Royal College of Nursing, and the Florence Nightingale Foundation, amongst others, I put the proposition to people, what if we created a super network of these organizations to power up nursing and speak with one voice on key issues, to create, in a sense, a coalition body, a UN for nursing? We now also have, during and after the pandemic, Nursing Now's Nightingale Challenge, adding its strength of its voice, its 62,000 members, to this choir. And I do realise and acknowledge that coordination currently does happen. But perhaps one thing we could do looking to the future is agreeing the messaging from the State of the World's Nursing Report when it's published, and planning dialogues, policy dialogues, in anticipation of its publication next year. This might help us amplify and level up our impact ahead of the game rather than being on the back foot. And drawing on the dance analogy, I also asked colleagues to think about who from the UN system would they like as their dance partners. And this was a fun way to explore relationship management and influencing tactics. Who is best placed where to do what, with whom? So we had this kind of matchmaking exercise, which was really created a lot of energy in the room. So perhaps we could take that further forward. We could look for the opportunities to coordinate and leverage leadership in the international arena further. So let's do it. And my second thought in this regard is that the pandemic accord that WHO is producing provides a further opportunity to use its tools and enablers to reframe what safe means in the practice environment. And as all of you will know, a safe work environment is the bedrock of worker well-being, which in turn drives retention, as well as access, cost, and quality of care. And we've used this evidence to good effect in our Magnet for Europe project to intervene in organizations in a twinning exercise, probably the largest and most ambitious organizational trial ever attempted, certainly in nursing, and definitely one that's designed to improve the mental health and well-being of doctors and nurses. So I think there's mileage in using the accord, as well as the International Labour Office's recommendations that come out of the accord, and perhaps even some that we're unaware of, to refresh the case for nurse well-being, building resilient systems and patient safety and employer accountability. And these can form part of a new narrative on lobbying and campaigning for better conditions that's so important and written into the DNA of the last State of the World's Nursing Report. And I'm sure this is going to be echoed in what's to come. But my final point is that this really spotlights the crucial role that line managers and supervisors play in our system. And as for investment, which is going to be a clear call to action, I'm sure, from the next Sound report, some of that definitely needs to be targeted at nurse managers, because they are the ones in contact with the majority of nurses at the bedside and in the community. We need to invest in them, not only because most health systems are undermanaged rather than what the media tells us is that we have too many managers and we must get rid of them. They are undermanaged and underinvested in them. And that can produce a kind of multiplier effect on the benefit and well-being of our staffs, and particularly our young nurses. Support is contagious in the best sense of the word. So let's move on intergenerational leadership, and let's do it now. Thank you so much. I think that's probably my 5 minutes gone.
Oh, sorry, Diva, you're on mute.
Thank you so much, Anne-Marie. And I remember I was at that meeting and I remember you speaking. And thank you so much for envisioning what we can do and to do it now. Please enjoy your evening and thanks so much for joining us so well just before your commitments. Thank you.
Thanks a lot. Have a great webinar. Thank you.
Thank you. Now, to open our session, as we have traditionally done with a video, this time we are sharing a video by the Nightingale Initiative for Global Health that was created for the year 2020 and beyond in Florence Nightingale's own words. And when we finish this video, it'll be my pleasure to introduce our keynote, Dr. Amelia Tuipulotu. Okay, Francesco, if we could have the video. Thanks so much. Thank you so much, Francesco, for sharing that with us. To let you know that Nightingale's words, these words that we used for the 2020 year, was the basis for which we established the Nightingale Initiative for Global Health in the early 2000s. And the basis for which we are doing this Nurses Voices speaker series and today's Nurses Voices into the Future. And so if you wish to see this video again, it'll be on our recording, but it's also under the multimedia section on NI's homepage at www.nivision.net. Now, it is a privilege and an honor to be introducing our keynote speaker. I'm going to get my glasses here. Dr. Amelia Latu Afuhaamango Tuipulotu is the World Health Organization Chief Nursing Officer. She is formerly the Kingdom of Tonga's Chief Nursing Officer between 2014 and 2019, who also served as its first female Minister of Health between 2019 and 2021. Since 2019, she has been an honorary adjunct associate professor at the University of Sydney, Australia. And in 2020, she was appointed as a member of the World Health Organization Executive Board and WHO Executive Board Rapporteur. With great gratitude, I welcome you, Dr. Amelia, for our keynote.
Thank you, Dr. Diva Marie Beck. I am delighted and so proud to be one of the 29 million nurses' voices, advocating to advance primary health care and universal health coverage for all the more than 8 billion people of the world. Last month, at the 77th World Health Assembly, approved the General Program of Work 14 with an overarching vision to promote, provide, and protect the health and well-being of all people everywhere. This mission is underpinned by 6 interconnected strategic objectives, and I will speak to 2. Objective 3, advance the primary healthcare approach and essential health system capacities for universal health coverage. Objective 4, improve health service coverage and financial protection to address inequity and gender inequalities. These 2 objectives cannot advance without long-term investment in nursing and midwifery. Every country needs competent, motivated, protected, valued, and well-supported nursing workforce. Nurses are the cornerstone of a strong, resilient health systems, needing to advance primary health care, improve access, equity, and gender equalities, and universal health coverage. The 25 by 25 Basic Emergency Care Campaign that aims to improve access to BEC training for nurses and midwives in 25 countries by 2025. This will enhance equity to quality care for the underserved population. The 77th World Health Assembly also reached a historic agreement on a package of critical amendments to the International Health Regulations 2005. One of the new amendments includes a commitment to solidarity and equity, including for developing, strengthening, and maintaining core capacities in prevention, preparedness, and response-related capacities. Thus, strengthening nursing and midwifery capacities is critical as the world prepares for future pandemics. The courage, competence, and compassion of nurses showcased during the COVID-19 pandemic, and especially the toughest times, inspire all of us. One of the side events during the World Health Assembly was entitled Moving Mountains, Leveraging Nursing and Midwifery Policy Leadership in Central Asia and Beyond to Improve Health Outcomes. This session showcased the work of government chief nurses from 4 Central Asian countries, supported by the Swiss University Hospital Group, in introducing a broad set of reforms on quality education, research, models of care, leadership to strengthen the capacity of nurses and midwives in their respective countries. Before the World Health Assembly, WHO, ICN, and ICM held the first ever Global Partners meeting on nursing and midwifery. This meeting was formerly known as Triad. There were more than 300 in-person participants from more than 150 countries. One of the sessions was on key issues and challenges for midwives and nurses delivering on primary health care in small islands developing states, which was represented by Mauritius, Jamaica, and Fiji. We also held the first meeting of the steering committee for the State of the World Nursing Report. Thus, next year will be a very important year during the 78th World Health Assembly for the 29 million nurses around the world. Finally, I am honored to have made series of bilateral meetings during the World Health Assembly, including with honorable ministers for health, and every one of them voiced support for nursing and midwifery. Let us continually scale up nurses' voices into the future at the policy table, engagement with new partners, including leaders, politicians, finance, donors, and our communities, together to advocate for support and investment in nursing and midwifery. May our voices and work continue to be inspired by the finest of humanity, that is, compassion in caring for others. So proud to be a nurse. Merci beaucoup, malo aupito. Thank you very much.
Thank you, Dr. Amelia. I must say that when we shaped the plan for the Nurses' Voices speaker series, we envisioned that we would have a speaker who could speak to the World Health Assembly that just occurred, and you did that so beautifully, just as we envisioned. Thank you so much. Your presentation will be a resource for us for a very long time. Thank you. Now, it is my privilege to be introducing glasses. Representative of the WHO with Afuhaamango region, Dr. Doreen Dodie Harper is the Emerita Dean of the University of Alabama at Birmingham School of Nursing. And during her time as Dean, she was also the Fay B. Ireland Endowed Chair in Nursing and served as Director of the Pan-American Health Organization, PAHO, World Health Organization Collaborating Center on International Nursing at UAB, one of the 10 centers in the United States that focus on nursing education to improve the care for children and families through global outreach. It is a privilege to be introducing our friend and colleague, Dr. Harper. Dodie.
Thank you, Diva, and welcome to everyone. Good day, wherever you are. and I want to thank you for the opportunity to really use my voice to comment on nursing's future. As a retired dean and professor, I've dedicated my life to this work, and I have some comments I think are about how we can continue to strengthen our nursing leadership and also work together and in our policy development and also policy voice and setting the agenda for health and universal health for everyone. Just reminded of what a small world we all live in, how connected we all are to each other, and how health is a universal right for all, and how that is the bedrock of nursing. And all that we do, not only with the Nightingale Initiative, but with all of our international initiatives, it brings that home to me. And with 29 million nurses worldwide, we have the power to activate our voices in ways that I think really can be heard differently. And we've learned so much from the pandemic, and it certainly accelerated how we work together differently, how we use technology to work together, and that's evidenced in just today's presentation and all of you that are joining us in this presentation. I want to do a little replay from Dr. Anne-Marie Rafferty's story about the dance. I was at that dance. Diva was at that dance. Probably some of Naima, I don't remember if you were at that dance, but it was really, really fun. And what was most fun about that dance is we were dancing with all of our partners. And I'd like to focus on that today as we think about how we can really grow and develop our strength in nursing. We've been depleted some in the pandemic. We all know that, but we've got to restore and we've got to continue to build. And to me, we build by connecting with each other, and we draw our strengths from each other and our resilience from each other. I will just say that given the gaps and inequities across healthcare delivery, and this is everywhere, it doesn't matter where we are, healthcare, our systems are not working, they are broken. And to me, the only solution is nursing and nursing leaders who can work to partner both at the local level and moving that forward at the global level. One of the things that strikes me is nurses have as one of their core competencies this expertise in interpersonal relationships and relationship building, which is so crucial in terms of how you work together both with individuals, families, communities, populations, and each other. And so continuing to build and grow and develop that work, I think is essential. But as I spent 50 years in academic nursing, devoted much of my career to partnering across disciplines, across communities, across healthcare systems, across the world. And I learned that work by the bootstrap. It wasn't taught to us. And I would suggest to this group and to everyone that we need to build that competency and develop it and refine it with our nursing leaders. Because I think it is the one area that continues to need to be developed. often, and I remember sharing this with many people, the expectation was you would partner and it was just a handshake and it would just happen. And yet it doesn't just happen. You have to have resources. You have to dedicate the resources. You have to have people committed to partnering with each other, not just one or two, but across the globe. And believe me, that Glasgow meeting was I think, a hallmark of some of that work that started among nursing and then continued to develop it. And I love to monitor those happenings as I see it. But I think we've got to develop a higher level of leadership and partnering competencies. And that is what's going to help us develop creative solutions to this work and build a healthcare system that works. Nursing is at the nexus of this healthcare system. You've got nursing and medicine. There's no getting away. I used to have this conversation constantly with our faculty in the School of Medicine. That's the nexus. But nursing is the constant in that nexus, as you know. And it's not just in a healthcare system. It is across the entire spectrum. And when you think about the 29 million nurses, how can we shore up their resilience and their competence to feel like they can use their voices in this work as leaders at every single level? I would just say, I think partnership competency is one of the highest levels of leadership because it means seeing beyond your own work and seeing the work of others and then identifying where you both in and through your relationship can really develop mutual goal setting, an action plan, and working together in a way that really ultimately changes policy and improves healthcare. I would also share with you that it was a real privilege for me to be the director of the WHO Collaborating Center. I had learned from one of the best, Dr. Rita Carty, who had been at this work for many years. And I was privileged to be a part, to be mentored by her. But I can tell you one of the things that we've been able to do at UAB through the EMERA region, actually led by Dr. Ada McCarkey, is to actually build the PANMAC, which is the group of collaborating centers in the EMERA. And one of the things I'm most proud of is that they have actually set up coordination and collaboration and partnerships about working with the University of the West Indies and Trinidad and Jamaica and Tobago. But they're doing it as a group rather than everybody doing their own thing. They're looking together to work together to strengthen that work as opposed to one group at a time, even partnering. So they're coordinating their partnership. And I think that in and of itself is an example of how you can strengthen the work and the impact and ultimately address the 4 priority areas that have been laid out clearly in the World Health Organization report. I would also say, and I'm very proud of this work, that UAB School of Nursing actually has built a whole clinical and global partnership initiative into its own infrastructure in the school. And we actually have more than 40 partnerships with communities, with the state, with global work, and it is embedded in the work that we have done and continue to do, because we believe that that is the only way to reach so many of our populations who do not have access to healthcare. Alabama has a lot of issues and a lot of problems. I told him I wasn't leaving till we got a midwifery program, and we got a midwifery program back. But the truth of the matter is, there is so much work to do, and we cannot do that work alone. So in conclusion, health profession, more than 60% of the world, across the world, but our capacity exists to lead and raise our voices and to advocate and provide universal health coverage for all persons. If we support each other, partner together, we can accomplish more than we can do alone. Thank you.
I see it looks like Diva's disconnected. But our next speaker is, excuse me, it's Dr. Hyeonkyeong Lee from South Korea, who is unable to join us in person today, but has shared a recording of their presentation. So I will be sharing that screen right now, and I'll be posting their bio in the chat for everyone to see.
Hello, everyone. It is a great honor to be here with you today as a nurse's voice speaker. As a Korean nurse educator, I'm very delighted to have the opportunity to share my thoughts with the audience from other countries and promote our care, compassion, and commitment to improving global health. It has already been 3 years since the adoption of the Nursing and Midwifery Strategic Direction 2021-25 report by WHO, and we are now faced with the challenge of building on our achievement and preparing for the next 5 years. I would like to talk about the education aspect of the 4 pillars of the strategic direction. In nursing education, in particular, I will comment on preparing students to develop competencies in technology and global perspectives, as well as the nature of the nursing. It's a new generation in the digital age. It is impossible not to mention the technology skills students need to have. During the COVID-19, nurses played crucial roles in primary healthcare settings. The recent policy research conducted by WHO Collaborating Center at Yonsei University College of Nursing confirmed the nurses acted as comprehensive care providers, supporters, coordinators, information navigators, and change agents. One of the key focus of our research was on the significant impact of technology on the evolution of primary health care. Nurses recognize the need for tools like telehealth for effective strategies and safety during the pandemic. However, the rapid adoption of technology without appropriate training left some nurses feeling unprepared. In addition, digital health has contributed to improved access for certain vulnerable populations, but more needs to be done to ensure the digital accessibility. Let's take a look at our nursing education environment. Is there currently a nursing curriculum in place to empower students with information and technology competency? Are student practice sites addressing the challenges faced by populations with limited access to technology? In South Korea, the Nursing Education Accreditation Board has recommended that technology competency be mandatory in nursing curricula starting in 2022. Yonsei University School of Nursing proactively updated its curriculum to include the technology competency already in 2020. Educators need to recognize the changes in the education landscape and actively collaborate at the national and international levels to share and adopt innovations. Second, global competency is essential for today's and tomorrow's healthcare workforce. In an interconnected world, nurses must recognize global trends, embrace global citizenship, and address global health issues. Nursing is now closely linked to the Sustainable Development Goals, demonstrating a commitment to promoting health and advocating for health equity. Nurses play a key role in translating these global goals into tangible actions for a healthier, more equitable, and sustainable world. This vision expands the future of nursing across practice, education, research, and policy. Leading nursing organizations like ICN and Sigma Delta Tau International advocate for integrating these goals into nursing education. The WHO collaborating centers are also active, and we need to collaborate more together. When I was a university student, I was told to go global by a professor who was a missionary. And I also was told to cultivate global awareness by Dr. Moin Kim, the former president of ICM, which means that we have to constantly prepare not only language skills and cooperation with the foreigners, but also the high level of political awareness. I was lucky enough to be educated in such an environment that fostered this global awareness. At that time, there was no social media to communicate about world issues, and online education sites like Nurse's Voice were unimaginable. What is crucial to develop a curriculum and supportive educational environment that encourages global thinking and perspectives in new nursing students. It is essential to provide opportunities for international exchange and activities and to cultivate global competence with a sense of global citizenship. To achieve this, we must be open and actively involved in global work between nursing education institutions across countries and continents. We believe this is our responsibility as nurse educators to prepare the competent nurses of the future. As a nurse educator, I continually remind nursing students that the nature of nursing involves caring for dynamic, resilient, yet fragile humans. It is crucial for students to see nursing as a valuable profession that meets and advocates for people's health needs, contributing to a healthy quality of life. While it's important to adhere to the essential curriculum and competencies set by professional institutions for quality management and academic development, this should not be the sole focus. Nursing education must emphasize the human-centered, evidence-based perspective of the profession. Overemphasis on preparing for licensing and certification exam may limit student understanding of human development and the core of nursing care. We also anticipate the government and organizational investment in developing nurse educator capacity to enhance the quality of nursing education. Nurse educators in the Western Pacific region and globally must collaborate closely to train nursing students who will make significant contributions to society in the future. In today's globally connected society, I'm very excited to share with the public how important nursing education is for a healthy global community and the effort our nursing educators to develop good nurses around the world. Thank you for listening.
Thank you so much to Dr. Lee for her beautiful recording and her PowerPoint. It was wonderful to have the voice of a WHO collaborating center head for WHO Wipro and for Asia. And I hope that she will be happy to see how we've built her into this important session. Thank you so much, Dr. Lee. Now, it is my privilege to be introducing Dr. Nthabiseng Phaladze, representative of the WHO Afro region. Dr. Phaladze is professor of nursing and former head of the nursing and the director of the WHO Collaborating Center for Nursing and Midwifery at the University of Botswana. Her research and scholarship have been focused on HIV and AIDS across different populations and other healthcare issues, such as health policy, human resources for health, gender issues, and neglected tropical diseases. I was privileged to meet Dr. Nthabi at WHO meeting in 2014, and it was wonderful to be bringing her back. This is based on our conversation. Dr. Nthabi, thank you for being with us.
Good evening and I guess good morning to you all, and thank you for having me. So I would like just to share my, add my voice to the conversation. I hope okay. I hope you can see my slides. Okay. Okay, thank you. I thought I would also, I want to acknowledge the previous speakers, especially when they're speaking to primary healthcare and the contribution made by nurses and what they continue to do, because they're the major, health workforce in any country. And I just wanted to share with you what the country is currently doing, revitalizing primary health care, especially given the experience we had during the COVID pandemic. So the advent of COVID-19 highlighted the gaps and deficiencies in several key areas in the Botswana healthcare delivery system, such as infrastructure, policy, education, leadership, and manpower shortages. And the lessons learned from the COVID-19 pandemic in Botswana has sparked a keen interest in revitalizing primary healthcare to strengthen the healthcare system and also to improve service delivery. The critical shortage of doctors, nurses, midwives, and other healthcare personnel created fear, anxiety regarding access to services, particularly during the lockdowns. And the 2030 agenda for the SDGs has extended an opportunity for governments and the international community to renew their commitment to improving health of the nations. Thus, the focus of this discussion really is on nursing and midwifery development and their contribution to health of our populations. So Botswana has now embarked on reforming its health system, envisioning attainment of universal health coverage through a transformation agenda. This process is guided by the principles of revitalization of PHC approach to service delivery and sustainable quality healthcare services. It calls for an investment in international health regulations, public health security, and epidemic preparedness and response. And I must say, in Botswana, we're not really prepared for COVID-19 pandemic. There was also a feeling since the African continent didn't seem to have been had a hit initially, that maybe it's never going to visit us, but then we did, it did impact us negatively. So this, from the state of the world's nursing, 2020 is clear that this presents also a compelling case really for considerable yet feasible investment in nursing education, jobs and leadership. Investment in nursing and midwifery education would really ensure the achievement of the Sustainable Development Goals through attracting and retention of talent. We lost the nurses to migration during the HIV/AIDS epidemic, and I think most of you who would know that Botswana was hardest hit by HIV, and it was still trying to recover from that. And when we thought we were recovering, then we had COVID-19. And then we need to really invest in education for development of advanced skills and competencies, and also improve, safe care for our patients, and also to improve access, commitment, that will also improve commitment of nurses to their work when they're supported, productivity, and reduce financial burden on clients. We realized that during the lockdowns, it was really difficult to access services. And we also suffered when nurses, the few nurses who were deployed to COVID centers also created shortages in the other health facilities, which also meant that patients did not have access to care, no quality patient care, because some of the nurses where they did not have the advanced skills to deal with those patients. So advanced practice nurses and midwives would increase access to primary care services in rural and remote communities and address the disparities in health equity. My country is a developing country, so really the general population is found more in rural and remote areas. And in those areas, you would find that there's an inequitable distribution of health personnel. They were more concentrated in urban areas, thus depriving those rural communities of specialized care, thus compromising the care they receive. These are just some of the policies put in place by the government of the Ministry of Health to address some of those disparities and some of the issues that I'm raising. So the lessons that we also learned from COVID-19 was that there was limited access to health services, inadequate and or lack of specialized nurses in critical areas such as intensive care units, emergency units, pediatrics, and all of those. And that was really highlighted. We always knew, and as a nurse educator myself, we are aware, and we've been pleading with government to train more nurses and midwives in higher education. But as usual, there's always that resistance. But during the lockdowns and during the COVID-19, they realized the need to do that. Critical shortages due to redeployment to COVID-19 care centers and units, disruption of services, especially for SRH, HIV, and TB. So we also then, as a consequence, medication, adherence to medication became another problem, which we thought we had resolved. The social, psychological, and emotional burden due to morbidity and mortality experienced by both providers, clients, and communities due to loss of life and the illnesses of relatives, friends, and colleagues. And there was neglect of other health conditions due to this focus on the pandemic, because nobody really knew what was to be done. And sadly, during the pandemic, a task force was constituted to try and address some of the challenges and to keep the nation informed. In that task force, nurses were omitted. We raised concerns and complaints, but little was done. Yet it was the nurses who were really taking care of patients. And this is why I feel strongly that, nurses need to be involved in policy making and so forth. So the lack of psychological and emotional support of both clients and nurses was a big concern. The neglect of other health conditions also created other challenges for conditions such as diabetes, hypertension, and all the other NCDs, and including cancer itself. So that the lack of preparedness for emergencies really, I'm thinking in future, we really need to be more prepared, because this is not the last epidemic or pandemic. We're still going to see a lot of those given the climate change situation. The poor and inadequate health infrastructure was another major challenge. The lack of equipment and PPE, well, all those things were problems that we then had to confront. So now, as mitigation, there's the move to reform the healthcare system, which is aligned to the health systems framework by WHO, comprised of the 6 blocks: the leadership and governance, organization and management, health information, health financing, the health workforce infrastructure, medicines, vaccines, and so forth. The government of Botswana is committed to providing quality health services closer to the people. We have the, I'd like to backtrack a bit. After the Alma Ata Declaration 1978, the government took it upon itself to make sure that the population, for every community with more than 500 people, they would build a health facility. Of course, there are different levels, so that the walking distance, like I said, most people are in the rural and remote areas, would be at least within 5 to 8 kilometer radius. And, so that was done. But somewhere along the process, when we were doing very well from 1979 to the just before the AIDS epidemic, we're doing very well in terms of preventive services, health promotion services. But with the advent of AIDS, things changed. We became more curative oriented. So this is why I feel we have to go back, revitalize primary health care. A community support strategy has been developed to guide the establishment of a unified and coordinated community health work program approach. So some of the mitigating strategies after we nurses through our professional organizations, through our participation in discussions with engaging the Ministry of Health. They have appointed the Director of Nursing Services at the Ministry of Health. So now we have an office there, which we hope will help us leverage, on that to get some of the things done. They've also embarked on training in mass education of nurses. We have more than 200 nurses sent to different universities and other health training institutions for both basic and advanced degrees in different nursing and midwifery specialties. The Ministry of Health, collaborating with the University of Botswana School of Nursing for training of nurses and midwives, we have received, our enrollment has really increased. In one class, I have a class of, community health nursing of 374 students for undergraduates. So it's a big thing because we've been really making noise about this. And the Ministry of Health is also working with us at the School of Nursing in the development of nursing leadership, because some of the problems really are due to the fact that nursing is left behind. We need nurses to be trained in leadership and management so that they can also manage their own affairs. So these are some of the things that in future, and I'm highly involved in the development of nursing and leadership curriculum. So I'm hoping next time we'll be having that for our master's degree nurses. So in conclusion, I still believe strongly that investment in nurses and midwives education and training is not an option. Lessons learned from COVID-19 pandemic provides an impetus for creativity and innovation in planning, designing and organizing healthcare services, and that nurses and midwives should be actively engaged in policy-making decisions that govern their own practice and their education, and also through their work and the professional organization and regulatory bodies. We should continue to agitate to make sure that our voices heard, and that employers should ensure that conditions of service for nurses and midwives provide for safe practice and living spaces, particularly in remote and rural areas. And that indeed, as per the WHO World State of Nursing, no global health agenda can be realized without concerted and sustained efforts to maximize the contributions of the nursing workforce and their roles within the interprofessional health teams. So that's what I thought I would share. And this was some of the documents and references that I used. And I thank you very much for your attention and for inviting me. Thank you.
Thank you so much, Fabi. I feel even more confident that Africa and the African region will be doing a great deal to be supporting the growth that we need as nurses and midwives. And you are a strong voice and a model for us. Thank you again, Nthabi.
Thank you.
Now, it is my privilege to be introducing Dr. Phaladze Mandrakar, representative of the WHO Siro region. Dr. Mandrakar serves as Director of Nursing and on the Board of Trustees of the PD Hinduja Hospital and Medical Research Center in Mumbai. In this role, she oversees more than 700 staff members. She is a widely respected regional nursing leader focused on the needs and welfare of nurses and midwives across her nation and region. She has also served on the board of the Nightingale Initiative for Global Health since 2011. It is my privilege to be introducing our friend and colleague, Phaladze Mandrakar. Phaladze.
Thank you very much, Dr. Diva Marie Beck. It's been an honor and pleasure to have been associated with NI during the past decades. Today, as we speak about the South Asian countries, I'm very proud to represent all of them from my country, India. A very happy and a very good late evening from here. It's indeed an honor to share our thoughts for countries surrounding me, voicing what nurses foresee for nursing here. Unfortunately, healthcare has been one step lower for health achievements, and hence nursing has been a goal waiting to be reached equally for all. Saying this, we have our own benchmarks showing we are much better today than decades ago. However, we have a large amount of activities in our future, and we hope over a period of time we reach our horizons. The World Health Organization, WHO's Global Strategic Directions for Nursing and Midwifery, GSDNM, focuses investment in 4 key areas. And that's what we strongly believe would be our future if we are able to achieve these benchmarks. Primarily nursing education, secondary nursing jobs, thirdly nursing leadership, and finally nursing practice and delivery. Our future would be secure if these 4 key areas are focused through a national agenda in our countries. Process implementation, assistance from WHO, philanthropic initiatives will go a long way. Appropriate nursing education that's objective and affordable. Affordable is something which is, in bold and underlined. Along with opportunities towards higher education, needs to be accessible to all nursing aspirants and nurses. We invite more global institutes from Europe, USA, UK to follow examples set by Japaigo, who set nursing simulation labs in many countries here. John Hopkins, Sigma Nursing, who partner on knowledge share, research, student nurse exchange, and assistance in establishing cross-country programs go a long way. We would want this example to be exemplified in multiples in many areas throughout the Southeast Asian countries. A strong nursing education is the foundation of good nurses, and we have some excellent nurse academicians and robust national nursing bodies here, who, if are strengthened, can be one of the best on a global scenario. And I'm sure everyone would agree to that. Investing in nursing jobs. This starts with supporting nurse numbers, because that's our, key hurdle. We need nurses, and we need nurses in large numbers. Unfortunately, international nurse immigration is a fast-moving factor that has damaged nursing manpower stabilization in our countries. A factor to be considered is develop and use a national level nurse retention policy. Better social status for nurses, along with recognition, autonomy, and professional respect, needs to go alongside. This is the responsibility of the society towards a nurse. A nurse with a good self-esteem, I'm sure everyone would agree, is a happy nurse. A nurse knows her job here. She needs good facilitating environment. Work environment with apt equipment, infrastructure, and good operational policies. Key message over here is allow the nurse to nurse. Taking away non-nursing away from nursing is the best policy for the nurse. Most of our countries have a public-private divide. A partnership to share assets is a vision for the future. Similarly, standardizing appropriate nurse remuneration is a key to this solution. In India, it has worked in many places and also contributed to good nurse job satisfaction. Hence, nursing jobs and counteracting workforce challenges with the right nurse numbers would be what we want in the future. Investing in nursing leadership is the need for the hour. Primarily, nurses need to be led by a nurse leader. This may sound as an odd statement, but unfortunately, this is a harsh reality. Many regulations now have made it mandatory for nurse academics and services to be headed by a nurse leader who is qualified with a postgraduate or higher nurse qualification. However, it is still not a rule and regulation everywhere. We recommend autonomous nurse leaders who lead national nursing bodies, represent the ministry, the government, head academics, nursing, and nursing research departments to be a good mandate to the future of nursing in that country. And this is what is our goal and our wish for the future. Nursing practice and delivery has always been a concern, and good nurse leaders facilitate practicing full extent of their education in order to influence and adapt to new strategies and models of care. The education and service divide needs to be null. A national policy dictating this is extremely essential. The critical issues, however, is the safety of the nurse and their health and well-being. Protection for the nurse in a safe environment is now a regulation adopted by many, and however, an encompassing law stating this is still something which we look forward to. So what would be our priorities for 24-25? Primarily, this would include transformative nursing education. Transformating nursing education provides current and future generations with knowledge, competencies, values, and skills. This is needed to achieve the goals outlined in the 2030 Agenda and the Paris Climate Agreement. However, this is something which everyone else in other fields also would look forward to, but we would want to keep this as a role for nurses. Rural nursing retention is something which we would look forward to on a larger scale. This is something which, we would want to talk about in a bit of a depth. We belong to countries where internal nurse migration from villages to cities is rampant. However, villages is where nursing and healthcare is most needed. Improved retention of nurses in rural and undeserved area is fundamental for a well-performing primary healthcare system that contributes to achieving UHC and enhancing equity. Countries in the Southeast Asian region are implementing many of the rural retention interventions proposed in the WHO Rural Retention Guidelines. These countries generally need programs to monitor the outcome, effectiveness, and impact of these interventions. The underlying reasons to strengthen the gap is a robust human resource for health information systems and evaluation and research capacity. National policies advocating good infrastructure, strategic policies, safety, and nurse recognition will strengthen the nurse retention in rural areas. Equivalence between the city and rural health institute also would go a long way. Data and information is what is essential today to compute the national nurse statistics. Digital nurse and patient data would go a long way to analyze outcome strategies. Examples of Dell computers, Tata computers offering cost-effective assistance to nurses is extremely popular in the country from where I come from. ICN has been formative to involve themselves to initiate this process, and you can find more details about this on the ICN website. We look forward to this being the case everywhere else too. Health system governance. Health system governance refers to processes, structures, and institutions that are in place to oversee and manage a country's healthcare system. It manages relationship between different actors and stakeholders involved in healthcare, including government agencies, healthcare providers, patients and their families, people and communities, civil society organizations, and private sector entities. Unfortunately, the word private sector has been repeated again and again in our countries. And the reason for that is extremely simple. Healthcare is directly related to a private and a public healthcare organizational system. Over a period of time, we would want an equity established for healthcare, which can be entitled to each and every individual who comes from our country. Healthcare system governance means ensuring strategic policy, framework, which exist and are combined with effective oversight, coalition building, provision of appropriate regulations and incentives. Effective healthcare systems governance is essential for ensuring that healthcare services are accessible, equitable, efficient, affordable, and of high quality. This requires efficient and equitable allocation of healthcare resources. The presence of policies and regulations guiding healthcare delivery and mechanisms for monitoring, evaluating, and reviewing the healthcare system's performance. Unfortunately, a poor healthcare governance leads to poor nursing. A healthy healthcare governance is essential for good nursing. The Regional Committee for Southeast Asia is focused on formulating policies, provide oversights for regional programs, and endorse new initiatives. ICN support for NNA, the National Nursing Association, needs to be exemplary. ICN has already readily assured this. Emphasis on nurse leaders' opinion materializing in action is the key. This is also translated as promotion of nurse leadership that's paramount to lead this transformation. What else can we wish for in our country? We have a big list, but I'm sure over a period of time, we will be able to achieve our future, which looks excellent when we speak about it, but we look forward for it to materialize in action. Thank you for listening.
Thank you so much, Phaladze. You have shared with us a beautiful set of details and envisions, and brought us brought us how the Southeast Asian region is addressing the strategic directions. Thank you so much for your contribution and your voice. Much appreciated. Now, our last speaker, it is a privilege to be introducing Dr. Naima Al-Ghazir, representative of the WHO Emerald region. Dr. Al-Ghazir has more than 35 years of experience at global and regional levels and has served at the World Health Organization for 25 years. Excuse me. She is the immediate former WHO representative in Egypt and was formerly the senior advisor to the Office of the Regional Director and the WHO representative in Sudan. I'm going to stop now and just let her speak. Dr. Naima, thank you so much for being with us.
Thank you very much. Very impressive group. I'm honored to be here. I am here from the Middle East, but however, I have worked in almost 4 to 5 continents. So I will bring the background, and every speaker touched on part of my background. And this has been a great reflection. I would like to thank the Nightingale Global Health. I would like to thank the York CFL, and at the same time, UNITAR. This is a very good, visionary, futuristic, and we are talking about bringing the voices of nurses. I have the slides, but most probably I will go through them, and at the same time, I'm trying to share now. Maybe I will need the help, but I want to control. How can I do that? It doesn't come shared. Okay, I saw it. Khalas. I saw it. I hope it will share. Let me know if it's done. However, I want to say one thing. Every single presenter brought a part of solutions, of hopes, of love, and at the same time, I cannot share it, Francisco, I don't know. It goes to email.
Would you like me to share it? I have the presentation
Yeah,
here.
please, and then I will
okay.
tell you to stop, maybe, because I was trying to control the flipping to make it faster.
No problem.
Yeah,
Yeah, just
okay,
let me
I
know.
saw it. Khalas,
Okay.
I saw it here. No. I'll cancel. I just want to bring 3 messages for clarification. I want to thank Dr. Diva for inviting me to this. Today, I have brought this session, wanted to join, so to be part of the group. And we know that we do have nurses in the Middle East region. There will be a session for them. I understand now it's been shifted to the 10th of October. So it will be the similar like other regions, to be speaking much more in details. I just want to make sure that we have the slides. Do you see it? I have shared it.
Yeah, we can see it. It's not in
Okay.
presentation view, but we can see the slides.
Okay, I will just put it on a presentation mode. Is it okay now?
Yeah, that looks good.
All right.
Thank you.
This is just to bring to us that here very, very clearly, all of us spoke about health and not sickness. And when it was addressed on the provision of services, we are talking about the universal health coverage, which was a major during the World Health Assembly. And it talked about health promotion, disease prevention, early detection, protection. We already talked about protection and promotion, but also preparedness that has been mentioned in all the team. One of the things that I have been always doing, I have been a young nurse as a student that I was privileged to be at the policy decision-making when Alma-Ata was discussed as a nursing student first year. And that is something that I see as a history which is current that needs to go into future. To bring the nursing students as part of the policy decision very early on, to be mentoring them, to be coaching them so they can be the future leaders. And I put this definition of primary health care, because what happened with us with primary health care, according to my assessment, is that as an organization that I served over 26 years, we moved to the medicalization. And now we are back trying to say it's no longer only medicine, it's a much more broader health. And that's where we see, when we know the initial definition of primary health care that was put in Al-Mu'atta, that is now coming back. You will see there a spirit of self-reliance. You will see the self-determination. Today, with digitalization, with AI, we are already there. And the persons, individuals, families who are really looking into us, they are actually wanting our experts, as somebody said, one of our colleagues talked about experts support, then rather than be told what to do. And that's why I put this definition after debating it. Okay, am I going down? Now, the health system, the primary health care broadband MDGs, health for all is still there, health for all by all is still there. That means inclusiveness that we have been talking is a word. In a country, in the region that I have served most now, we are going through a different dynamics than other regions. We talk about the health rights, we talk about the instruments of human rights, we talk about all this, but the nurses have really excelled to really work under difficult conditions. Every few years, we have a big conflict, big wars that others are involved in our countries, and at the same time, big dynamics that's going on in terms of all the violence and forces used, and still we want to meet the sustainable development goals. So one of the messages that came across today, that in order to reach the safety and the peace, we really need to see that health is a bridge for peace. And that's my background throughout my expertise, whether when I was a faculty at the College of Health Sciences or when I became a WHO collaborating center director, and then I moved to be a senior scientist. Today we are calling it chief nurse, or for me it was senior scientist for nursing and midwifery. We were always trying to bring with every voice, our voices for peace, our voices health rather than sickness, and our voices that nurses care. Why I put this slide? Because partnership came across all the messages that we heard today in different ways. Partnership is goal 17. If you recall, MDGs, Millennium Development Goals, that were shrink, for me, it was partnership was number 8, and it was the weakest when they did the benchmarking, the weakest result. Today, we want to make a difference when it comes to the SDGs, and we know we are behind. This is one of the things discussed during the World Health Assembly 2 weeks ago or 10 days ago, that we need to really look how can we accelerate to reach the goals. Inclusiveness. Now, I put this because somebody talked about the climate change. I think it was our CEO speaker. But one of the things that we are talking about, International Health Regulations, 2005, it has been a tool used, especially that I worked in complex countries, as a tool for peace, to bring everyone around the table, everyone that you can think of. Ministers of Defense, Minister of Interior, Minister of everyone, the ones who are fighting, the ones who are holding the guns and shooting, everyone to be around the table, because when we talk about health, everybody will listen. Viruses, bacteria do not know border. They do not need visas. They do not want to be, they cannot be killed by the bombardments. They cannot be, they are there and they will happen. That's why everybody is listening. And I will assure you, I have walked the talk. When avian flu happened in 2006, everybody wanted to listen to the health as a bridge for peace, everybody. Because really we had to bring everyone around the table to really protect for peace, to bring security. This is from the Constitution. It talks about upon the fullest cooperation of individuals and states. I always ask families, communities, societies, institutions, people, private and public, because it's not only individuals, it's all of us, and already it was mentioned. And we should not forget the most vulnerable. This slide is quickly to show in every single epidemic, pandemic, health, promotion, nurses have been at the heart. They are the core. That is non-negotiable. In my role, I have moved from being senior scientist for nursing to be WHO representative for Iraq. And then I came to Egypt as an assistant regional director. And then I became Egypt and then Sudan and again back in Egypt. Why I'm sharing this? Because if we want nurses and midwives to be at the policy-making level, the first thing we need to do is to know the governance. Somebody's talking about the governance. We need to know entities and organizations. In my role, my background is a nurse, but I am not, when I'm representative, I'm not doing only nursing. It's supporting the country, the member state. Member states mean public. It doesn't mean only Minister of Health or Ministry of Health. It means the whole state. It means the private sector. It means people, communities. I have been privileged to be actually doing this representation, working all the entities. Who doesn't know this information? Our nurses. And they think you are doing only nursing. So they will not be able to say, we do have a nurse representative sitting with the policy decision making, and we want more nurses in this post. We want more nurses in the senior level. The World Health Organization, my own organization that I have served all these years, yet to have nurses in almost all the key pillars. I'm not talking only at the headquarters, but I'm talking at the regional offices. So these are some of the decisions that we need to bring as future voices, because now it's time. It is time, and the call of actions have been there, but we need to walk the talk now to implement the resolutions. So when we talk about the declarations of 2018, the accessible, available, affordable, accessible, it's still there, cultural acceptable. When I put this slide, I had debated to put it or not. But I come from a background, Florence Nightingale has impacted us all. I also come from a background that we had a nurse in the Islamic era during the Prophet. Her name was Rufaida al-Aslamiyya. She served during these wars. She also was a statistician, collecting the data. She kept the basic hygiene, preventing the infectious control. As part of infection control, sanitation, environment, cleanliness. These are the basics of any primary healthcare and the basics of any social determinants. When we talk about social determinants of health, we are also talking about the gender equity, somebody mentioned already. And this is something, equity between human beings, and the lens of equity has been brought. Why I brought this history, Dr. Harper might remember that we did have the first global network. It was partnership. It brought ICN, ICM, everyone around the table, Sigma Theta around the table. Collaborating centers moved it. And then when I went to Geneva and had the first global strategic directions, guess what? 9 partners around the table. We did a global report, and we need to respect the history, respect our presence, moving into future, building on this, not starting every time as if it is the first note. And very good, the nurses are actually respecting the history with Florence Nightingale and others, but at the same time, where are we moving? Why I showed Princess Muna, she is still today, and already one of our colleagues mentioned her, she is still today supporting us fully, and it still is one of the voices. She's originally a nurse, a voice of the nurse in a position that all of us should speak with. Not to forget that the global state world of nursing and the same with midwifery really shaped the strategic directions of where we are going. Why I put ICN, the economic power of care? I put it purposely because it is time for us to really, really educate our faculty, nurse managers, to speak with the language of dollars. Dollars. Not only for us to be having a better situation, but how much savings we have done. Believe it or not, we did this in Bahrain more than 3 decades ago, convincing the government that if they bring less person to the service, call the nurse, there will be increase in money, dollar, increase in health, decrease in health, but at the same time, increase in cost. Today, we need more of this. And today, I believe yesterday there was a publication by University of Penn, by Linda Aiken, again proving that if we are really moving to the voices that they think we can reduce the health services cost by changing the caliber of nurses, are actually we are taking the wrong direction. Florence Nightingale has taught us to build evidence to negotiate the change. She taught us this. Havden Mahler, I don't know how many of you have heard. I had the privilege to work with him before I joined WHO. Nurses are powerhouse of change for primary health care. He said this, we should teach every single nurse this. Walk and the talk, this is what is it. What does it mean, powerful change? Already it was mentioned in all. The highest political commitment by leadership. I was privileged to be with the late Nelson Mandela, and it was on the social summit, high level, and it was about health at the core of social summit. And when I see this, it's positioning nurses. It's not easy. Having nurses at the World Health Assembly, alhamdulillah, it's happening now. We have really pushed, and Dr. Amelia already mentioned, but at the same time, UN summits and Global Health Summit. Very pleased now we have the Nightingale Global Health, the Sigma Theta Tau, the presence in the different summits, but we need to bring the young generations with us aboard. There is active work happening in climate change and health. One of the things that I'm still continuing education myself in this area. This is something that we all do as nurses, continuing self-education, that we need to look at the health professional education, and especially nurses. They have a role to positively change the negative impact of climate change through our individual behavior, through our family behavior, through role modeling. And these are also linked to the international health regulation and linked to pandemic accord, definitely towards the zero carbon health facilities in the health sector, decarbonizing health sector. I think Dr. Manjiker spoke about the use of digitalization. If you see the economics, the past few months, almost every other week, they have on digitalizations, AI, and how it's going to affect. Nurses will not be affected. Nursing care, compassion, competence would be needed always. The mental health support, the counseling, because they are always there. They can use digitalization to do a better care of it. No universal health coverage without a strong health workforce, particularly nurses and midwives. This is a challenge we have. I put it here as a challenge. We are speaking to ourselves now. I don't know how much we are measuring now with the strategic directions for nursing and midwifery that's being benchmarked. We know that many countries, believing that private sector needs to come more, believing that they need to have a less cost in terms of putting money, then we need to bring a different kind of nurses and midwives. And that's why I brought this slide to really look in terms of really building on our science and building on our, the evidence to bring for the change, because we are inspired, and for being informed is critical. So we can speak about it. Already the influencing was mentioned. We do need to really bring the songs. I mean, when Dr. Anne-Marie was talking about the songs and singing, I believe we have solutions. We need to scale these solutions up, scale it up, scale it up. Hold hands, hold hands. I'm sure you have already heard this many times, but at the same time, look at the human rights instrument and code of ethics. We are challenged in my region now because there is the polarization that has happened. We cannot ignore. Nurses will play and midwives will play a role to actually invest in the peace, and at the same time to really bring the different, I would say, the divided entities together. We are the largest, 50 to 60% of any health sector. Health is as a bridge for peace. I believe we can do it and we can move on this. So we do have the voices. And when we see what is Nightingale, it's music, it's love, it's actually bringing the voices. It symbolizes in some countries as a power and beauty. I believe we have it all in the nursing community and midwifery community. We are able to do it. We do have the niche. And the more important thing is it is time and time we speak about when we are at the policy making level. Please, let's measure what change we brought. Let's measure what, it's not just the pace. We need to be sitting there. And we need to document when we have a face representing nurses, how many of us are supporting that nursing voice to be ready to go to any board meeting or any summit meeting or any assembly meeting and speak on our base, all of us behind that nurse, he or she. So coming to the Nightingale, we are migrating. Migration is good and positive, but we need to implement code of ethics that WHO did. That's another tool in front of us that we have not yet fully materialized it. Music to transit, music to actually bring the change. This is for our mental health. And I always believe that we do have the power. It's just the will to bring the partnership. And we have many successes to show how can we, when we are working together and we are contributing, we can improve the education, practice, leadership, governance, putting the people at the center. And I would like, with my last statement, that we will use the digitalization, artificial, but not to forget it is time to bring the integrated professional together and time to change our accreditation. I have been the past few weeks speaking about time to look about accreditation system, because if I want to make any curriculum change, what does it mean transformative? What does it mean transition? What does it mean preparing the future competent personnel, especially nurses and midwives? Thank you very much for this opportunity, and well-being and health for everyone. Thank you.
Thank you, Dr. Naima. What a powerful presentation to close our Nurses Voices speaker series, Nurses Voices into the Future, with the solutions that you have demonstrated and sharing, and for your collaboration with us, with all of us. Thank you, Dr. Naima. Now, it is my privilege to be sharing a traditional thing that we do with every seminar that we do, and that is to bring the Nightingale Declaration for a Healthy World. I'm going to share my screen. The Nightingale Declaration for a Healthy World is now available in 14 language versions: Arabic, Armenian, Chinese, English, French, Korean, Portuguese, Russian, Spanish, Swedish, Tagalog, Filipino, Turkish, and our first indigenous version, Kiswahili. We welcome new language versions and language collaborators, aiming to represent all nations, including indigenous versions from across the world. And now we begin. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve a healthy world. We declare our willingness to unite in programs of action, to share information and solutions, and to improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nations, making this goal achievable and inevitable, beginning today in our own lives, in the life of our nations, and in the world at large. Florence Nightingale. What did she envision for us? In 1893, she said, "We are only on the threshold of nursing. In the future, which I shall not see, for I am old, may a better way be opened." May we hope that when we are dead in God, leaders will arise who have personally experienced the hard, difficult work, the difficulties and the joys of organizing nursing reforms and who will lead far beyond anything we have done. Please join us with your voice at the Nightingale Declaration for a Healthy World, now in 14 language versions. We will have many more languages at www.nivision.net/declaration. And also, as Naeem had mentioned, coming in the fall of 2024, we'll have one more session in this series, Nurses' Voices from the Middle East. I know for myself, I know many others who have been praying for the Middle East mightily across these last months. And we look forward to what the Nurses' Voices of the Middle East will share with us, featuring Dr. Naeem as our keynote speaker. And now it is my privilege to be introducing the closing remarks from our co-moderator, Cyril Ritchie. Cyril is the distinguished UN NGO representative of the Nightingale Initiative for Global Health in Geneva. As one of NICE's founding advisors and board directors, Mr. Ritchie serves from his decades of related experience and leadership. In 2018, he was elected first vice president of Congo, the Conference of Non-Governmental Organizations in Consultative Status with the United Nations. Congo, the organization of 600 member organizations. He has served for 2 terms as Congo president before serving for 40 years and 5 separate terms as the secretary of the Congo Conference Board and first vice president. It was my privilege to meet Cyril Ritchie in 1999, and he has been our helper, our advisor, our consultant, our encourager across these many years. We are grateful you are still alive with us, Cyril, and now you have celebrated your 90th birthday, and you are still with us and helping us to close this session. Cyril.
Well, thank you very, very much, Deva, my very dear friend. And I have also several friends on the screen. I see that we're keeping remarkably well to time. We're approaching the last minutes now. And of course, that means I have to do the usual impossible job that you ask of me, to make remarks that endeavor to touch upon some of the main points that we've been hearing over the last almost 2 hours. One of the things that I noted is that in addition to the countries from which the speakers came, we had people from Myanmar, South Africa, Egypt, Nigeria, Guyana, Bulgaria, Trinidad and Tobago, Afghanistan, Brazil, Ghana, and more. That's a tremendous outreach showing the basis on which nurses' voices are being heard around the world and must be heard around the world. Now, after this wonderful gender imbalanced panel, you note that I'm the only man speaking, and I'm also the odd man out because I'm the only non-nurse here. But it's my tremendous privilege to say you are all wonderful people. In her cover note for today's session, Deva said that she wanted to focus on the voices into the future, of course, as this is being part of the nurses panel, and that we should learn from the global strategic directions for nursing and midwifery. That's very much to the point. And she called it our beautiful yet ever-changing profession. Perfectly true. I can only pick up half a dozen of the points that remain very, very much with me without even identifying which particular speaker may have made them. I was very encouraged by the number of references that were made to the Sustainable Development Goals. When one speaker, and Deva having revealed my age, it's clear that I'm the oldest person present, but when one speaker spoke of the Alma-Ata conference in 1978 I had a tiny role in relation to that. And remember how enthusiastic we all were at the end when it declared health for all by the year 2000, 22 years later after the conference. Well, of course, we're still nowhere near there yet, but we may get nearer to that if we do implement the SDGs, notably the health SDG, but all of them, because that's the challenge to governments, to civil society, to every profession, to every citizen, to actually implement the SDGs. By the way, the same recall back brought another name to the front of my mind when Halfdan Mahler, former DG of WHO, was quoted as saying, "Nurses are powerhouses of change for primary health care." I knew Halfdan Mahler quite well, including when he left WHO and joined the International Planned Parenthood Federation, one of the most important NGOs in the world, under attack like many are. And there's the sort of leadership that he gave, and that many others gave, Gro Harlem Brundtland above all, perhaps, to say, here are the leaders that nurses can work with, must work with, and will benefit from working with. So let me pick up a couple of other sentences simply in the 2 minutes that I was supposed to have. The world must prepare for future pandemics. How true. And in that preparation, nurses are essential preparers, not just executors. Nurses must be in at the beginning of every discussion as to how we meet health crises and other crises in the future. And that means, as one other speaker said, that there has to be coordinated leadership. I was struck by the remark by one speaker that most health systems are in fact undermanaged. And I'd like to hear all nurses' opinions on that and how nurses can be more involved in the management of health systems. Because nurses are, as we've been hearing, not just executors, but the people who count at the heart of it all. So there's just a few of the things that struck me most. There are many, many others. And let me close by saying a thank you to York University for being such a faithful partner throughout this series and for providing such admirable and unfailing technical support for this. And Deva, you and Barbie, thank you for your imagination and persistence. You have made this possible. Keep going. You're a young woman. Keep going. There's a lot more to be done. I'll be with you to the end. Thank you.
Cyril, thank you so very much. How brilliant to have your remarks as the close of this session. Now, Francesco, I think we're finished. I want to say one more thing, if I may. One of the things that I learned across these decades of working to discover how nurses can be global citizens. One of the most important things I've learned is that the tools and tasks for global work are always communication tools and communications tasks. The WHO, the United Nations, the other global bodies all use communication tools, and their task is communication. And so for us, the Nurses' Voices Speaker Series is a way to demonstrate that, and we have demonstrated that, and we will continue to be demonstrating it along the way. Remember, our tasks are communication tasks, and our tools are communication tools. And when we use those at global levels, which we now have social media to do that, we are global citizens making an impact on global health as never before. Florence Nightingale said to us in 1893, "You must form public opinion." And this is what we're doing now. All the best to you all. Francesco, perhaps we have some time for questions.
Yeah, thank you so much, everyone. Yeah, we have a few minutes left. So if anybody in the audience would like to ask a question in the Q&A function or raise your hand, we can give you permission to talk. So we can just have a couple of minutes. I see one person has their hand up, Fidelis Peter Olou. So maybe we could give them a chance. Hi, Fidelis, if you want to unmute and say a couple of words. Yep, perfect. We can hear you there.
Francesco, can you hear me? Please confirm.
Yes, we can hear you.
Okay. Thank you very much for the audience. First of all, I must say a very big thanks to all the speakers. You all are awesome, for real. Two things I just want to point out here. We talked about nurses being part of decision-making process, you know, in the various countries and regions and what have you. I don't know much about the West, but right here in Africa, I'm calling from Nigeria, Port Harcourt City, Nigeria. Now, right here in Africa, I think nurses do not even participate in the policy-making process. I mean, the decisions that govern them, the laws that govern nursing practice in Africa, nurses do not even participate in most of them. Why? I think we need to start creating this awareness to people that, to nurses generally, worldwide, that power will not be given to you because you desire it. Power will not be given to you because you're crying for it, you're rolling on the floor for it. No, power will be given to you, or it will rather become yours when you go for it, when you take it. Okay, so maybe I just want to use this medium to encourage nurses to, you know, try venturing into politics, because that's where the decision-making power is. That's where the policies are being made. Since I became a nurse, it was just one nurse, a male nurse, just one that I've seen becoming, I think, a commissioner of health in one of the states in Nigeria. You know, we can have more of that. We can have more. Look at medicine, for example. A lot of them are into politics. 2 governors in my states, Delta states, 2 governors, 2 past governors, had medical doctors. They were medical doctors, you know. So if they want to make anything, if they want to implement any policy, you know, affecting healthcare in the state or even in the country, because of the influence they've already built politically, it becomes easy for them. But when you are not known by anybody, you are not, you know, you're not contributing politically to the system, nobody takes your opinion serious. They see you as one of those members of those pressure groups that just like making noise, disturbing and distracting government all the time. So let's try to encourage nurses to take part in politics and policy making, you know, processes and groups. And then secondly, Diva made a very, very important point, talking about social media, nurses becoming global citizens. Obviously, when you are active on social media, you become a global citizen. Yeah, but then how many nurses in Africa and some other parts of the world are actually active on social media? Let me take this webinar, for example, now. I saw this on the group, and then I went in immediately. I found it difficult getting in at first, but then I had to register, you know, do everything real fast just to get in. But I believe over 80% of nurses that saw this information just ignored it because they will not be able to maneuver their way through. And it's true. So maybe we can also be having workshops to train nurses on the use of social media and, you know, platforms like this. If we organize workshops to encourage nurses, to train nurses to use things like this, I think that will help us, you know, a great deal. Thank you very much.
Thank you, Fidelis.
You're welcome.
Thank you. We do have one other person who has raised their hand, Kathy Douglas. I'll give them a chance to talk quickly. We are a little over time now, but that's okay.
Well, hello there. Thank you. This may be very similar to just what was discussed, but one of the things that I'm quite interested in is, first of all, thank you to the extraordinary leadership that's been represented here today. But I'm thinking of the everyday staff nurse. I'm thinking of the nurses who are at the bedside, who are tired and exhausted and don't have time to get involved in politics. You know, I'm just wondering if there's some thoughts or ideas around how we share this. This message is so important, and I feel like every nurse should be hearing it. And I'm wondering if you have ideas on how we can get this kind of awareness of global citizenship, of the incredible work that's going on by these extraordinary leaders, and get that information, you know, down to the masses of nurses, if you will. Anybody have any thoughts on that? Why are you giggling, Diva?
You can hear me giggle. It's my microphone is excellent. Yes, we have many ideas, and it will be good to discuss this in many ways. There are dozens of ideas in the heads of everybody presenting today, and of course in your head as well. So yeah, we have much to do, and we need to leverage, as Dame Anne-Marie said before. We need to find partners. We need to walk our talk, as Dr. Naima has said. We need to see and appreciate what WHO has done in the last years, what Dr. Amelia is achieving, what the WHO collaborating centers are achieving. We have so many things to do. And so we'll see. I'm committed to doing what you have asked for, and I know many others have, and we'll see what happens. Let's stay in touch.
Thank you.
Great, thank you so much for the question. Then just quickly, we have a question in the Q&A from Dr. Nala Suleiman. They're asking, I think they're referring to something that Cyril said, but I might be wrong. But they're asking if by global citizenship you mean a diplomatic passport, or if there is something else from that comment.
Cyril, please, can you answer that? Cyril?
If it's addressed to me, I do not remember using the term global citizenship, but I would, because nurses are on the front lines of global citizenship as well. There's a comment also in the chat that I would like to respond to, because it's someone has suggested that if nurses are in politics, or anybody is, they have to toe the party line. I think that's totally wrong. Remember that when Gro Harlem Brundtland was first appointed Director General of WHO, in her first speech, she said, health is politics. And now many governments are saying, oh, that's very dangerous. That's nonsense. Politics is not party politics in this sense. It's engaging in policy-making decisions. And that's where the people who know what they're doing, i.e. nurses, are most needed, that bring their experience to the policy deliberations which lead to better politics. If we can influence governments to make good decisions, those decisions will be better and more implementable. That's the sense of making good politics for good health.
Thank you, Cyril. Thank you so much. And just to answer briefly, global citizenship is a consciousness. It's a level of understanding the value of the need for global health and the value of each of us bringing our voices and our commitments, our walking, our talk to the global dialogue. That's global citizenship. And thank you so much for that question. Francesco, I know we're over and we could be talking for a very long time.
Yeah, thank you so much. Just really quickly to wrap up, thank you, Cyril, for those great closing remarks. Thank you to everybody for those great presentations. And of course, always, thank you, Dr. Beck and thanks to Dr. Dossi, who unfortunately couldn't join us today. But thank you both for all of your work putting this series together and putting this session together as well. It's been a great experience working with all of you. So thank you all so much. Thank you also to everyone in the chat who took the time to be here and watch the presentation live. Just as a reminder, anyone who wants to review the presentation or share it with their networks, this is being recorded and will be up on our YouTube channel and on the Nightingale Initiative website as well. And just one final reminder, this is session 7 of 8, so there is one more session coming up. It will be Nurses' Voices from the Middle East. We're just working to finalize all of the details and the date, so please stay tuned. As mentioned, now we have social media, so we will be sharing everything on our social media as soon as all of that is finalized. So please stay tuned for those updates and keep checking the Nightingale Initiative for Global Health website and the CFAL York website, as updates will be posted on our websites as well. And with that, just one last big final thanks to everybody. It was a great session, so thank you so much for being here.
Thank you. Thank you.